Today we will talk about different grade of traumas of your different abdominal organs. So first of all, we will start with spleen. So we have five grades of trauma in spleen. In grade 1, there is subcapsular hematoma of less than 10% surface area or a laceration of less than 1 centimeter. In grade 2, previously in 1 there were less than 10 centimeter. In grade 2, there will be 10 to 50% of surface area, or intraparenchymal hematoma of less than 5 centimeter. The laceration will be greater. Last time the laceration was less than 1 centimeter, but now the laceration is 1 to 3 centimeter. And now the hematoma is more than 50. In the grade 3, the hematoma will be more than 50%. In grade 2, it was 10 to 50. In grade 1, it was less than 10. And now the intraparenchymal hematoma is greater than 5 centimeter instead of your lesser than 5 centimeter. And in less and it also can grade third can also be attributed to laceration of more than 3 centimeter. In the grade 2, it should be 1 to 3, or in grade 1 that was less than 1. So it is very easy to remember. The laceration is less than 1 centimeter in grade 1, in grade 2 is 1 to 3, and in grade 3 is more than 3. Okay. And the hematoma is also very easy to remember up till now. 10 less than 10%, 10 to 50%, or more than 50%. Or in grade 2, there is intraparenchymal hematoma of less than 5 centimeter. In grade 3, more than 5 centimeter. So up till now, that is very easy to remember. In grade 4, the things changes. Okay. In the grade 4, there is laceration of segmental or hilar vessels that causes devascularization of more than 25% of the spleen and parenchyma. Okay, and in grade 5, there is completely shattered kidney or complete devascularization of spleen parenchyma. So grade 4 and grade 5, there is only laceration of in grade 4 there is more than laceration of 25 centimeter percent, and in grade 5 there is complete devascularization of spleen parenchyma. So if hematoma is greater than 50%, that is grade 3, and if the entire parenchyma hematoma is more than 5 centimeter, it is grade 3. If the laceration is more than 3, it is grade 3. But if the laceration is of hilar vessel, that is and causes the devascularization of more than 25% of spleen parenchyma, that is grade 4. And if it's caused the complete devascularization, that is grade 5. So that is your splenic in trauma complete. This is the grading of splenic trauma. Now moving forward to the liver. Okay, so liver is 6 grades: 1, 2, 3, 4, 5, 6. Now I'm telling all these grades according to American Association for the Surgery of Trauma Organ Scale. In grade 1, there is subcapsular non-expanding hematoma of less than 10 cm surface area, similar to that of spleen, and also similar to spleen, laceration is less than 1 centimeter. The grade 2 is also the same, but the laceration that is 10 to 50% surface area, but the hematoma is was 1 to 3. Now there is it's less than 2. Now the laceration it also includes, as I've already said, the laceration is less than 1 centimeter in grade 1, but in grade 2 it is 1 to 3 centimeter, quite similar to that of spleen. Now the third grade 3 is subcapsular hematoma more than 50% surface area, and interparenchymal hematoma more than 2 centimeter, unlike the 3 centimeter we studied in your spleen. Just this very same, you can already see here. Now, the grade 4 has parenchymal disruption of 25 to 75% of hepatic lobe, and in grade 5, there is parenchymal disruption of more than 75% of hepatic lobe, and in the grade 6, there is complete hepatic avulsion. So, these are the grades of your liver injury. Now, moving on to pancreas. Pancreas also have 5 grades, and these are very easy to remember. You don't have to remember values here, but the values are very simple in spleen and from liver as well, because they are very similar. But here in pancreas, the grade 1 is mild contusion without duct injury. There is no duct injury. Grade 2 is major laceration or contusion, but there is no duct injury. So yeah, minor, major, no duct injury. In grade 3, there is duct injury, but it is distal transection and it is superior to the mesenteric vein, to the left, basically to the left of superior mesenteric vein. In grade 4, there is proximal transection. In grade 3, there was distal. In grade 4 is proximal transection. And here, there is injury to the duct of ampulla. Okay, duct or ampulla, if there is injury to duct or ampulla, that is grade 4. So easy to remember. Grade 1, minor contusion without duct injury. 2 is major contusion without duct injury. 3 is distal transection with duct injury, and 4 is proximal transection with injury to duct or ampulla. And 5, the massive grade 5 is massive disruption of the pancreatic head. Now moving on to renal, and it's quite simple as well, but you have to remember some values, not a lot. So in the grade 1, there is either hematuria without X-ray abnormalities in grade 1, and there is subcapsular non-expanding hematoma without the parenchymal laceration. There is a non-expanding hematoma around the parenchyma, but there is no laceration and there is no abnormalities on X-ray, but there is hematuria. So that has come to grade 1. In grade 2, there is perinephric non-expanding hematoma that is confined to retroperitoneum, and there is less than 1 centimeter laceration. It can be a non-expanding hematoma that is confined to retroperitoneum or a laceration of less than 1 centimeter depth. In grade 3, if there is a laceration of more than 1 centimeter but without the collecting system involvement, so when there is no collecting system involved, there is no urinary extravasation, that is grade 3. In grade 4, there is more than 1 centimeter depth, but as we said in grade 3, there is no involvement of collecting duct. Now there is involvement of collecting duct. Now there is urinary extravasation. And now in grade or there is no urinary extravasation, but main renal artery or vein is injured, which is causing hemorrhage. Now in grade 5, there is completely shattered kidney and there is avulsion of renal hilum as well, or avulsion of renal. So very simple to remember. Grade 1, hematuria without X-ray abnormality or subcapsular hematoma without parenchymal laceration. In grade 2, there is a laceration, but there is less than 1 centimeter and there is no urinary extravasation, or you have a non-expanding hematoma confined to retroperitoneum. In grade 3, there is more than 1 centimeter of laceration involving collecting system, though you have urinary extravasation. In grade 4, there is a laceration of more than 1 centimeter. In grade 3, there is no collecting system involvement, no urinary extravasation, but more than 1. In grade 4, there is more than 1 centimeter, but the collecting system involvement or your artery or vein is injured. In grade 5, there is completely shattered kidney or there is avulsion of the renal hilum. So moving on to the ureteric injury, which is kind of very easy. That is very easy to remember. In grade 1, there is contusion or hematoma without devascularization. Grade 2 has less than 50% of transection of the ureter. In grade 3, there is a 50% of more than 50% of transection, or in grade 4 is complete transection with less than 2 centimeter devascularization. And in grade 5, obviously there was less than 2. Now there is more than 2 centimeter of devascularization. So very simple to remember, and that's it for the most part. So let's revise all of them. So you have to remember the spleen and liver are quite similar. So you have to not remember a lot of values, but there is a value element in spleen and liver. Now in spleen, either there are 5 grades and liver there are 6 grades. In spleen, you have, if you there have subcapsular hematoma of less than 10% surface area. The similar thing is in liver, so the grade 1 is kind of the same. And either there is a hematoma of less than 10 centimeter or laceration of less than 1 centimeter. Same thing in both grade 1 and grade 1 are both of same, of spleen and liver are same. Grade 2 still same, 10 to 50% surface area, also 10 to 50% surface area. But here in spleen, the intraparenchymal hematoma can be up to 5 centimeter, but in liver it is up to 2 centimeter, and the laceration is same, 1 to 3 centimeter, and that will get to 1 to 3 centimeter either in spleen or liver. It's grade 2. But only the difference is intraparenchymal hematoma that can be up to 5 centimeter to be in the grade 2, but in liver that will be not grade 2, that will be more than, that will be grade 3. Okay, in the grade 3, the similar thing, hematoma of more than 50% surface area, same with the liver. But here the intraparenchymal hematoma in the liver, because liver has the sensitivity is higher, so as I said that it was 1 to 2 centimeter, now there is intraparenchymal hematoma more than 2 centimeter, while in the grade 3, as I said, in grade 2 that was up to 5, now in grade 3 that is more than 5. And laceration, now it is similar, that the laceration was less than 3, now there is less than more than 3. In the grade 4, now the change is after the grade 4. In grade 4 there is devasculation of 25% of the spleen. In grade 4, here in the liver is parenchymal disruption of 25 to 75% of the hepatic lobe. In grade 5 there is completely shattered kidney or complete avasculation, but in liver that is 75%, more than 75%, and grade 6 that's hepatic avulsion. Okay, so quite simple to remember. You can listen to this audio whenever you need. Now in the pancreas, that was very simple. Grade 1 binary contusion without duct injury, major 2 is major contusion without duct injury, 3 is distal transcription with duct injury, 4 is proximal transcription with duct injury, and 5 is massive disruption of pancreatic head. So very simple to remember. Now moving on to renal trauma, it is also very simple to remember. Grade 1, either hematuria without X-ray abnormality or parenchymal non-expanded hematoma without parenchymal laceration. Now in grade 3 there is laceration of more than 1 centimeter. I think I forgot about grade 2. Grade 2 there is a non-expanding hematoma or there is less than 1 centimeter of laceration. And in grade 3 there is more than 1 centimeter of laceration, but there is no collecting duct involvement. In grade 4 there is more than 1 centimeter with the collecting duct involvement, or there is massive hemorrhage because of the injury to the medial arterial vein. In grade 5 there is a completely shattered kidney or avulsion of renal hilum. And now in the last ureteric, very simple. Grade 1 contusion hematoma without devasculation. Grade 2 less than 50% transection. Grade 3 more than 50, easy to remember up till now. 5 complete transection with less than 2 centimeter of revascularization, and grade 5 avulsion with 2 centimeter, more than 2 centimeter of revascularization.